Black History Month is a time to celebrate Black culture, but it's also an opportunity to have some tough conversations. Our Candace Charles breaks down the stigma around mental health in the Black community, offering resources and some promising news.
After getting rejected, we just closed up.
Gina Hill has been dealing with mental health alone for 30 plus years. Her daughter started therapy at age 13 after a traumatic incident, while she suffered in silence until Hill lost her sister during the pandemic.
I got into the end of myself.
But her first stop wasn't a doctor's office, it was church.
People would want to pray, and I would pray, but I was still battling.
For many Blacks, church is often the first and only stop. 98% of psychiatrists are white, so the church was and still is perceived as the only place to lay down your burdens with someone who looks like you. Tyler Perry, UNLV's African American Studies assistant professor, says the lack of access in mental health professionals is just a part of the problem. In the late 18th century, when white physicians attempted to diagnose Black slaves, there was an assumption that Black people felt less pain.
Black Americans were effectively disenfranchised from any discussion about mental health,
leading to a foundation of suffering in silence.
And I think for African Americans, the mentality is that life has been rough being Black in America, and so you do what you have to do to survive. You don't have time to complain. You don't have time to stop.
The stigma that those who seek help for mental health are weak runs deep. In fact, one study showed that 63% of Black people believe that a mental health condition is a sign of personal weakness. Dr. Sheldon Jacobs with NAMI, the National Alliance on Mental Illness Southern Nevada, tells me breaking this stigma will help save lives.
Getting through some of those cultural norms is huge because they are barriers.
The good news, recent studies have shown that college-age Black people are seeking mental help at a higher rate. The hope is that they will be more likely to care for their children's mental health. For Hill, helping her child early made all the difference.
She actually is just getting her master's degree in mental health counseling.
That was Candace Charles there with that story. Now, we have a full list of resources, including a list of Black mental health professionals and the pastors who work alongside them on our website. You're just going to go to 8newsnow.com.